these conversations, these forums are an essential part of the process, but they are only the beginning of the process. What I think they're trying to do is set up the proposition that we need to take action at the congressional level. The president needs to step in with the Congress and quote, solve this problem. Now, for the nation to be persuaded that that's the case, we have to have a collective understanding that this is a big problem that's worthy of big action. And so that's why these public forums are necessary. But what's got to happen is the congressional action, shaping of legislation, and vote on the bill and all of that in Washington. And until that happens, this is a lot of sound and fury. It's important that people like me who are running these large institutions see the faces of the people that we care for, so that we're not just talking about thousands of patients and millions of dollars and whatever, but that we see one by one the people that are affected by the decisions we make. And it's important that people in Washington have that same sense that this is not just some mega problem facing masses of people, but it really is a very human story. She is a very smart, very able health finance, health delivery policy person. I think she's the best of the best, and our country ought to be pleased to have her doing what she's doing. She's got a huge job, and as I said to her, maybe I did in the public session, I can't remember, but I surely said it in the private session we had afterwards. I want to do everything I can to help her, help the president, help the Congress come up with a viable solution to these challenges. This is not a Republican issue, it's not a Democratic issue, it's an American issue that we really do need to solve. And maybe I'm just a glass half full person always, but I'm really optimistic right now that we seem to be on the verge of doing something very substantial. Let's not say we can't cover the uninsured because it'll cost too much, or we can't do these other improvements to our healthcare system because of their costs. Let's admit we are spending a lot of money already, and let's rather look for ways to spend that money more wisely, put it to a better use so that everybody benefits. There's lots of waste in the system, and I'm not talking about people stealing money, I'm just talking about we're not making smart decisions. And let's find ways to spend that money wisely so that all 300+ million Americans are better off.